So, Mike, before we get to the news about the president and the White House, let's start where we usually do by taking a quick look at the current state of the pandemic in the U.S. and the rest of the world. Is there anything you're seeing that changes your assessment of where things are headed right now?
Nothing that really changes the assessment. As everyone who has been following these podcasts know, for about the last month and a half to 2 months, I've been predicting this substantial increase in cases in the United States after Labor Day. It really is the collision of pandemic fatigue as well as pandemic anger, the concept I talked about over the last several weeks, where people who just don't believe the pandemic is real, believe it's a politically motivated activity, and therefore under no conditions will they comply with standard public health recommendations for how to limit transmission. If we look at what's happened, today we're going to be up to 42,200 and some plus cases. We're still looking somewhere in the neighborhood on average of 450 to 800 deaths, but those numbers are going up. In 24 states, the numbers are high and going higher. 16 states, the numbers are still low, relatively low compared to the other states, but they also now are increasing. For a total of 40 of the 50 states, the District of Columbia now showing this substantial increase. Only 11 are, in fact, what we'd call basically stable and not going up. I continue to have grave concerns about where the number of cases is headed. The combination of students at universities and colleges, while not adding a large number to the hospitalized population or those in intensive care, surely are adding to the transmission in communities where we're seeing it in those individuals who are at higher risk for serious disease. I talked about that last week, the CDC surveillance paper showing the increase first in younger adults and then the subsequent increase that occurred in the time period after in older individuals. So that's there. But in addition, we're seeing basically business back to usual kind of activities in terms of weddings, family reunions, neighborhood get-togethers, all the kinds of things that we would be most concerned about in terms of transmission. The worst thing that could happen is to have a joyous wedding only to have transmission occur and one or more family members at that wedding subsequently die in the days after the wedding. That's happening. These activities are not slowing down. People are back into public spaces. They want to be in bars and restaurants. I see it in so many locations. As I've shared with you before, my deep, dark secret here, what I do for entertainment, which is a very unfortunate commentary on my lifestyle, but I will get in my vehicle sometimes and just drive around late in the day and just watch to see what's happening with activities. And it's as if there's not a pandemic in the minds of many people. And so this number is going to continue to increase, and I think it could go up substantially over the course of the next 6 to 8 to 10 weeks, easily reaching the kind of peak that we saw earlier this summer in the July time period. Now, where there could be an interesting impact on this that I'm not sure how to factor in yet, and that is who actually does get tested and gets reported. We know we're doing more testing, so you could argue the cases should go up. But on the other hand, the percentage of positives is staying very high. So it's not somehow that we're just capturing more of what was already out there. The case numbers are truly going up. But I'm learning of, and others surely can confirm this, more and more people who refuse to get tested when they have symptoms of COVID-19. They don't want to know. I think it's illustrative of the problem we have right now in terms of individuals complying with good public health recommendations for reducing the transmission. When you just look at what's happening in the upper Midwest, you look at the states of North Dakota, South Dakota, Wisconsin, Iowa, Michigan, and what's happening there, it's remarkable. Minnesota's not far behind in our own state. I worry about that a great deal. But here's an example of what I can't believe anyone would accept as good practice in light of the events happening, and that is what just happened in North Dakota. There, the state which is tied right now for the highest incidence of disease in the country, very significant increased disease risk there. And the governor has just declared that the new quarantine recommendations for individuals who are exposed to someone with COVID-19 have now been changed according to his rules. And if you were wearing a mask and the other person was wearing a mask, you no longer have to be quarantined. So even though I was in contact with someone for an extensive period of time, I no longer have to be quarantined, assuming that these masks are perfect barriers. And we've talked many times about everyone should wear a mask, but we know that they are not perfect barriers. They are a layered effect. They are one more additional means of reducing risk, and that's it. And the fact that somehow someone wanted to, reduce the inconvenience of quarantine in a state that is on fire by coming up with this unscientific approach. And the worst part about it was the health department folks said, yes, we support this because the data shows that it works. There are no data that supports that works. I found that really difficult. And, we all want to have creative public health, but we want creative public health that makes a difference and doesn't serve as an illusion to people about what they can do to make life more convenient. So I think that we're going to have to follow this carefully. I also find it just a remarkable commentary. Wisconsin is another state that's on fire. The governor has all but pleaded for individuals to reduce close contacts to infected patients. And notably right now, state legislators in Wisconsin are trying to overturn the governor's statewide mask mandate, which just, if you did that during a time period when case numbers were down, not increasing dramatically, you'd still say, well, it's not a good idea. But how you could approach this at a time like this, it's kind of like in the middle of a house on fire and all the firemen are trying to put the fire out and you're inviting them all to come to tea at the local intersection. It's just not a good time to do that. The one good news piece that we have out of this, of course, is the fact that, the medical care has just improved substantially. The actual mortality rates, the likelihood someone would die when they get into an intensive care unit is 1/4 of what it was in April. And it's not because of some miracle cure, no blockbuster drug. It's because the intensivists, the doctors, the nurses, the support teams have really learned a lot about how to provide good medical care to these patients. And I think will continue to be one of the major bright spots in this entire situation. In terms of international activity, the trend also is continuing, particularly in Europe, in the Middle East, and to some degree in some select locations in Asia. When we look at what's happening today around the European Union, we're seeing substantial increases in cases. But what's interesting is when we talk about substantial increase in cases, again, let's put that in some kind of comparison to the United States. Just take Finland. Finland today reported its record daily high number of cases, and this made all kinds of news. There's considerations for a number of much more stringent public health requirements on being in public spaces, et cetera, et cetera. And as much as they are concerned about it, and rightfully so, and what they want to do something about it, just think about this. Finland has 5.5 million people. Collectively to date, they've had 10,929 cases, 346 deaths. So 5.5 million people, 10,929 cases, 346 deaths. Minnesota has 5.5 million people, exact same size as Finland. However, we've had 105,740 cases here and 2,087 deaths. More than a tenfold increase in the number of reported cases, and from the standpoint of deaths, 287 versus their 346. So when they're trying to put a lid on this and they're trying to dampen down transmission, they're at a place where they can do it much, much more effectively than we can. Because in a sense, as I've said before, it's pretty hard to try to plant your petunias in a Category 5 hurricane. And that's what we try to do when we're trying to do contact tracing and follow-up, when you have this many cases coming in, almost 1,000 a day in a state like Minnesota. So the European countries, while they're still experiencing these big increases, they are in orders of magnitude lower than we're experiencing here in the United States. And so they still have an opportunity to really suppress transmission, keep it down, where we are still really, really challenged with that issue. The European regional director of the WHO just issued a warning today talking about pandemic fatigue. Everywhere around the world is seeing it right now. I worry that humans are giving up a lot sooner than the virus ever thought about giving up. And so somehow we have to figure out, how can we help the population continue to deal with this issue, knowing that pandemic fatigue is normal. It's not something that, you have to fault someone for. But at the same time saying, you know what, you can't give up yet. It's not done. And I think that's the challenge we have today. But then I come back to that concept I started with. I have hope. I have hope that we will have conversations about what can we do? How will we deal with that issue? And where will we go? So right now, the United States is on fire and getting much hotter. The world is getting hotter, not quite full flames everywhere, but we worry a great deal about what is coming down the pike if, in fact, pandemic fatigue, and in our case, pandemic anger, become the norm.